Hello, my name is Chelsea Moyer, and I'm one of the PGY2 Health System Pharmacy Administration and Leadership residents at WVU Medicine. Today, I am going to be giving my final 522 presentation on social determinants of health and food insecurities in single Californian mothers. Today, I am going to be outlining social determinants of health, or SDOH, provide background support for why I'm talking about this topic and the impact it can have on Californians by using and discussing a data set. So, what are social determinants of health? They are conditions in which people are born, grow, live, work, play, worship, and age, and they influence a wide range of health outcomes. These factors are shaped by the distribution of money, power, and resources at global, national, and local levels, and they can either promote or hinder health and well being. The five domains include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community contexts. Throughout the coming slides, we will talk about the different domains, what factors fall under the domains, and then for Californians, what is the impact for the income and affordability for food. There are many reasons that social determinants of health are important, seeing that they have a major impact on individuals' health, well being, and quality of life. Anything from safe housing, transportation in neighborhoods, racism, document discrimination and violence, education, job opportunities and income, access to nutritious foods and physical activity opportunities, polluted air and water, and language and literacy skills can impact social determinants of health and someone's overall well being. These determinants are interconnected, meaning that improvements in one area, like economic stability, income, or access to food, can lead to improvements in other areas, like community well being and health. Addressing social determinants of health is crucial for reducing health disparities and promoting overall population health. So, when you're thinking of social determinants of health and how they impact the overall health of patients, you can see on this slide and in studies that 40% of an individual's health is determined by socioeconomic factors such as education, occupation, or income. Going down, you'll see that 10% is determined by one's physical environment, such as their community, house, or workplace. 30% is determined by health behaviors such as diet, exercise, or substance use. And lastly, only 20% is determined by their access to health care and the quality of that care. Poor social conditions like inadequate income, limited education, unsafe housing, and lack of healthcare access are key drivers of health inequities. It is well known that the United States has some of the highest healthcare spending in the world, one compared to other high income countries, but consistently ranks as one of the lowest as far as performance, one factoring in access to care, care process, administrative efficiency, equity, and health care outcomes. Putting it into perspective as far as social determinants, if you remember in the last slide, only 20% of a person's overall health is impacted by access to care and quality care. It poses the question of whether the United States is focusing our efforts in the right areas, such as focusing too much on treatment rather than prevention of chronic diseases. While the US is advanced in many ways, we do tend to be slower in investing in preventative care, public health programs, and addressing social determinants of health that could reduce the need for expensive treatments in the first place. Countries that emphasize prevention, such as those in Scandinavia, often see better health outcomes at a lower cost because they focus on early detection, lifestyle modifications, and reducing risk factors like smoking, poor diet, and lack of exercise. What many may not realize is that investing in social determinants of health offers one of the most cost-effective strategies for improving public health and reducing healthcare spending. Rather than focusing solely on treatment of diseases once they occur, as discussed on the last slide, addressing the root cause of health disparities can prevent many health problems from developing in the first place, reduce the need for expensive medical interventions, and promote more equitable health outcomes. In a study conducted by Honeycutt and colleagues, implementing social determinant determinant interventions at 13 multi-sector community partnerships in 20 years could potentially prevent 970 premature deaths, over 105 million in medical costs, and 408 million in productivity losses. To highlight the impact that income can have on well-being of a population, a public data set from California was used to assess the impact of food affordability based on income. The data contains average costs of a market basket of nutritious food items relative to income for households headed by females with children less than 18 years old. The state of California is using this data for indicators in the Healthy Communities Data and Indicators Project of the Office of Health Equity because they do recognize that a nutritious diet is necessary for all stages of life and can prevent negative health outcomes such as cardiovascular disease, obesity and anemia, and also improve things such as intellectual performance and increase attendance to schools and increase education achievements in children. In graph 1, you can see that the race and ethnicity with the highest income is white with about a roughly average income of $42,700, whereas the lowest average income is American Indian or Alaska Natives at a roughly $25,500. The affordability ratio is the ratio of food costs to income, specifically in this case for females heading a family with children less than 18 years old. The higher the ratio, the more that the family is using a portion of their salary to pay for food. For white Californians, the affordability ratio is 0.3, and for American Indian or Alaska Native Californians, it is 0.26. It's interesting to assess these numbers because you would imagine that the affordability ratio for American Indian or Alaska Natives would be higher as they spend more of their salary on food. This could not be the case if you think about factors such as food insecurities, where people are not spending spending money on food because they're worried about other factors and other things that they're needing to spend money on. So they're preventing nutritious foods and not getting access to nutritious foods. So it's just something to take into consideration when you're looking at data. Overall, it is important to understand that income as a social determinant of health can impact the quality and quantity of food purchased by families, especially when taking into consideration single mothers in California. Another impact on income and affordability food is race and ethnicity. The state of California is collecting this data and information to hopefully be able to focus on preventative care by assisting individuals with affordability of food. Other things to remember is that socioeconomic factors account for up to 40% of health outcomes for patients. Poor social determinants of health are linked to higher rates of chronic diseases such as diabetes, heart disease, and obesity. And addressing social determinants of health, such as income and food insecurities, is essential for achieving health equity and improving population health outcomes. Here are my references. And I appreciate you listening and tuning into my presentation about social determinants of health and food insecurities in single Californian mothers.